I'm going to cry. My nurses crumbling the floor from being so emotional myself. I get real emotional about this, but you know, I'm not a crier, but this has been very hard on my staff.
That's just one of the stories from our series, The Bravest Among Us. In March, News 19 shared the stories of nurses who worked on the front lines of the pandemic. At that time, there seemed to be a light at the end of the tunnel. Cases were going down. The vaccine was becoming more available. But that has changed.
The contagious Delta variant has spread at an unprecedented rate across Alabama. Medical staff, still exhausted from the state's January peak in cases, are facing the prospect of having to relive the most difficult year of their careers.
And this, while new challenges emerge. News 19's Kelly Smith shares their warning for the community.
As the first COVID-19 vaccines were distributed, the medical community buzzed with a sense of optimism.
We saw the light at the end of the tunnel, and you know, we had several days where we didn't even have any COVID patients, so we're like, okay, we've made it through this.
But now cases are climbing and the number of hospitalized COVID patients is rising.
It's just a big shock.
It's not the happy ending nurses were hoping for.
I wish we were just tired. I think we're exhausted.
It's the struggle of knowing what we went through for a whole year and then thinking everything was better for those few months, and then now seeing that it's starting back like it was, and we're scared. We don't know, is it going to get like it was before? Is it going to be worse?
That's not the only tough question.
What do we do? What's our next steps when the ICUs are full? We're fearful that since we see a resurgence over the past couple of weeks and we have folks in the ICU now on the ventilator, that it's only a matter of time where we start seeing the death toll rise.
It's playing out right in front of them.
We're seeing entire families come in sick because of the contagious nature of the Delta variant, whereas before we would see one positive family member and quite possibly not the rest of the family would not be ill.
The vast majority of COVID patients walking through hospital doors are not vaccinated.
The unvaccinated population comes in much sicker and they escalate to a critical state much faster.
But we've had patients that have come in here that were anti-vaccine and with COVID and nearly passed, and now they're out there, get the vaccine, get the vaccine. But for some of them, it's too late. You know, they've lost loved ones, or they've lost their own lives.
The virus isn't the only thing that's changed. So have the challenges.
The staff is very emotional. They have a lot of concerns. They just don't. A lot of them don't know that they can go through it again.
According to the president of the Alabama Hospital Association, models show the number of COVID-19 inpatients could increase to more than double the 3,000 patients hospitalized during the January surge. And there are fewer nurses now than there were then.
That's our concern and fear, is if we continue to, this virus continues to take over again, we're not going to have, you know, the staff to adequately care for the patients.
Nurses say there are two ways to help steer the community in a different direction.
From my point of view, it is time for me to put my mask back on.
What's your message to the community?
Give me a second. I'm sorry.
A heartfelt plea from the front lines of the pandemic.
I didn't know I was going to get emotional. Please research the vaccine. It works.
Kelly Smith.
Think about it.
News 19.
Get the vaccine.
According to the latest data from the Alabama Department of Public Health, there are nearly 2,400 COVID-19 inpatients statewide. In the past 7 days, nearly 18,000 people have tested positive for this virus. And the state has a 24.1% positivity rate in COVID-19 tests.